Voting is your right, but did you know it's actually good for your health? We learn more about the benefits of voting and play a game where we guess real and fake laws from around the country. There are some interesting ones, to say the least. Plus, we talk with Franklin County Public Health's medical director, Dr. Miller Sullivan, about how he balances being a family doctor with being a medical director, the shifts he's seen from the public around preventative care, and what we should all be aware of this flu season. All that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson alongside Angela Ta. The name of the podcast is Health is Real from Franklin County Public Health, coming to you today from Memorial Hall in downtown Columbus. Angela, how's it going today?
Real good. Happy to be here, Andrew.
Actually, there's a recent article from the American Heart Association about how voting actually plays a role in your health. I thought it was really interesting. Groups such as the American Medical Association and Heart Association have endorsed the idea that voting plays a role in health, making voting access something that healthcare professionals should be addressing. The way they describe it is sort of a loop. Health can affect someone's ability to vote, and then voting has a direct effect on public policy, which in turn influences people's health.
Okay.
So it goes in a circle like that. One historical example that they cite is after women won the right to vote in 1920, elected officials enacted public health measures championed by women, and then child deaths fell by 20,000 a year.
Wow.
So had an impact.
Yeah, huge.
Yeah, I mean, this is a really great article about how voting does play a role in health. There have been some successful nonpartisan efforts that give physicians and nurses badges with QR codes that link patients to voter registration information.
No way.
Yeah. And it also helps them request like absentee ballots.
Yeah.
So I think that's really cool.
That's really sweet. Yeah, especially because it's empowering the patient, like the actual patient, to make change for themselves and help the system help them, if that makes sense.
Oh, yeah.
That's very cool.
Yeah, absolutely. So voting's important.
Yep.
Voting's good for your health. So exercise your democratic rights and vote.
The elections, you got the big elections, you got the little elections, all kinds, all shapes and sizes. But it made me think of, how some states have some funny, interesting, quirky, I don't know what the right word is, laws, like bylaws, little laws, city, state, all different kinds of things.
I bet they do.
And I wanted to do a quiz with you.
Okay.
Yeah, I thought maybe we do it like 2 truths and a lie style, where I'll give you 2 real laws that are present somewhere in the 50 states.
Okay.
And there will be 1 made-up law that I came up with. And if you can identify the lie, the wrong law, you get a point.
Okay.
And bonus points if you can tell me which of the 50 states the right laws are from.
Wow. Okay.
Yeah. So it's going to get...
That's pretty tough.
I know. You got a lot of states to choose from, but...
Let's do it.
We're going to have fun. Okay. So the first grouping of laws I'm going to give you, the first one is you can't sell silly string to a minor.
Can't sell silly string to a minor.
Yes.
Okay.
Under 18.
Okay. Not someone who works in the mines.
Correct.
Okay.
Yeah. That's a fair distinction to make.
Sure.
Second one is no, you're not allowed to let your chickens cross the road. Yeah.
Okay.
Or you're not allowed to do commercial logging on Arbor Day.
Not allowed to do commercial logging on Arbor Day. Well, all of these are fairly ridiculous.
Of course.
I think the logging on Arbor Day probably is true.
Okay.
The chickens crossing the road, you're not allowed to let your chickens cross the road. That's the law.
Correct.
Okay. And then what was the first one again?
The first one is you can't sell silly string to minors.
See, that one's so ridiculous it probably is true. I think the made up one is the chickens crossing the road one. Is that right? Oh,
No.
So that's a real law
That's
somewhere.
a real law. Okay, let me tell you. I'll read you the legislation. It states, it shall be unlawful for any person owning or controlling chickens, ducks, geese, or any other domestic fowl to allow the same to run at large upon the streets or alleys of the city or to be upon the premises of any other person without the consent of such other person.
To run at large along the streets?
Upon the streets.
Upon the streets.
Alleys also.
So now I have to guess what state?
Yeah, tell me.
So it's just one state that did this law?
Correct.
Okay. I mean, it could be any state, really. Let's just go with Alabama.
Close.
Okay.
No, it is Georgia.
Okay.
So I'll tell you, the other one that is true in that grouping is you can't sell silly string to minors.
Okay,
which you were right.
I was right about that one.
So it is a specific city within this state. It's not the full state. No person shall sell or offer silly string or like products to a minor unless that minor is accompanied by a parent or legal guardian.
Interesting.
I also don't know what would be a like product to silly string.
I don't know either.
Like
so,
foam insulation? I don't.
I'm feeling like that might be Chicago. Is that like an Illinois one?
No.
It's not?
Connecticut.
Connecticut. Oh,
yeah,
okay.
So we're 0 for 2 or 0 for 3 on that.
So you're telling me that the made-up law was the Arbor Day?
Yeah, I made that
logging.
one up.
Well, that was very clever.
Thank you.
Because I thought that one made enough sense that it would be true. But...
I know. Thank you. It is my job to be creative. So.
Well, you're doing a great job. So what's the next one?
Okay, next grouping. 1, can't dye a baby chick. Like dye as in like alter the color of a baby chick. The next one is you can't catch a fish with your bare hands.
Okay.
Or you can't play hopscotch during the week in public places.
Can't play hopscotch?
Right. During the week.
During the week. So weekends are fine.
Weekends are a game. Okay. But I think it's public places too. So not on like your private property.
Okay.
Which one do you think is the lie?
I mean, they're all so ridiculous. I don't know which one. So it's either you can't dye the chicks any color.
Any color.
What was the second one?
You can't catch a fish with your bare hands.
Fish with your bare hands. That sounds like it would be true somewhere. That sounds like something a random state would do. And the third one was about the hopscotch.
Right.
If you made up the hopscotch one, that would be really impressive if that was the made up one.
Okay.
So I think the made up one is the chicks. You can't dye your chicks. Is that correct? No? Oh.
So the one that was made up by myself was the hopscotch.
Well, that's great. That was a really creative one. I don't know what goes on in your head to make you think of that, but great. Because it was so specific, too. It was you can't do it on the weekdays, but you can do it on the weekends.
Right, which makes sense. So if you think about it, because if it's in a public place, maybe it's getting in the way of people. Like, thank you.
Good job. Well, I still have yet to get one of these right, so that makes me feel
we got
good.
a lot more to go. So that means that you can't dye a baby chick, and you can't catch a fish with bare hands. Can you give me the states?
You can't dye baby chicks. Let's go Virginia.
No, it's Illinois.
Oh, Illinois.
I know.
Okay.
Yeah, I was kind of surprised by that one too. It says it's against the law in the prairie state to sell, offer to sell, trade, or display living baby chicks, ducklings, goslings, or other fowl or rabbits which have been dyed, colored, or otherwise treated as to impart them an artificial color.
That's a very specific way
according to Animal Care and
yeah.
Control. I know, yeah.
What was the next?
Don't catch a fish with your bare hands. What state do you think it is?
A state that borders water. Let's go New York.
No, Indiana.
Indiana?
Yeah.
Okay.
So it says Title 14, Article 22, under Chapter 9, states that a net, bare hands, dynamite, or explosive may not be used to catch aquatic.
Dynamites and explosives too.
Yes.
Okay.
Yeah, I mean, that one is totally reasonable
yeah,
to me.
That probably should be illegal in more places. But
But it's funny because I think about catching catfish. There are people who catch catfish with their bare hands. Like you essentially like use your hand.
That's super impressive for people who can actually do that.
Also terrifying, but the funniest thing is that it's called noodling.
That is funny.
Why?
I don't know.
I've
never heard that.
I think it's because the motion you have to make with your hand, essentially, and your arm by extension,
is like a noodle.
Is like a noodle, yes. And then the catfish kind of like onto your arm, and then you just go.
Oh,
just,
so
like, raise
that's
your
how they're
arm up.
catching them is by the fish like swallowing your hand.
Yes.
Yes. That's even more impressive then. I thought they were just going in and just grabbing them.
Oh no. Your arm, your forearm is essentially being ingested.
It's the bait.
It is the bait. Your arm is the bait.
Gotcha.
Terrifying.
But not in Indiana.
Not in Indiana. Okay. Next group of 3. 1, you can't sell cars on Sunday. Okay. If I'm reading my terrible writing correctly, that is what I wrote. You cannot collect seaweed at night. And you cannot arrest someone on Christmas.
Okay. You can't arrest someone on Christmas.
Yeah.
That jumps out to me as like, well, obviously that one's wrong because you can commit crimes any day of the year.
Right. But this is saying you can't arrest somebody. You can be booked. I don't know what the difference is, honestly. Do I look like a police officer to you? I don't know these things, okay? I'm just saying, you could pick someone up and hold them and then maybe like actually process their arrest the next day. No, I don't know.
Well, I'm going to guess that one is the lie because that's just... Is that right?
I thought I was convincing you.
Oh, right. I finally got one right.
Shoot. I really thought I was convincing you.
I mean, it just feels like that means that you can do whatever you want on Christmas.
No, because here's the thing.
Uh-huh.
I modeled this one after the one in Ohio, our great state.
What?
Which,
if
this is wrong, someone please correct me, because there's going to be a lot of people who are in Ohio that listen to this. Section 2331.21 of the Ohio Revised Code.
Sounds official to me.
That's what I'm saying. Yeah, so that section of the Ohio Revised Code specifies the days that arrests cannot be made. No person shall be arrested during a sitting of the Senate or House of Representatives, comma, in the hall where such session is being held, comma, or in any court of justice during the sitting of such court, or on Sunday, or on the 4th day of July.
What that might be saying, and again, it's written in such a way that laws are written where it's difficult to understand.
Correct.
But it sounds like you can't arrest someone that is like physically there at those particular locations when those things are in session, is what it sounds like. Not just like rules don't apply in our city. Sure.
No, I would absolutely agree with you. Yeah, we're not saying anyone can just run amok on the 4th of July and not get arrested for it. Correct. I would agree with you. I think it is talking about a specific place, people group on specific days.
In specific locations, yes.
Yeah. Wow. Super specific.
But
Ohio.
What matters most is I got that one right.
You did. Yay.
So what were the other two?
So the other two were you can't sell cars on Sunday. Mm-hmm. Any idea where that may be from?
What's a state I haven't said yet? North Carolina.
No, sorry. Womp womp. Missouri.
Huh. Okay.
Yep. According to Missouri's code, the law states that no dealer, distributor, or manufacturer who isn't licensed may keep, open, operate, or assist in keeping open or operating any established place of business for the purpose of buying, selling, bartering, or exchanging, or offering for sale any motor vehicle, whether new or used, on Sunday.
Did it say only the unlicensed ones can't do it? Is that what it was?
Yes.
Okay, so if you're licensed, you can still sell on Sundays.
Apparently.
Okay.
Apparently.
Interesting. And what was the other one?
Can't collect seaweed at night.
Okay. Yeah, that sounded kind of ridiculous, so I figured it probably was true.
Yeah.
Seaweed at night. Let's go Oregon.
New Hampshire.
New Hampshire. Wrong coast. Okay.
New Hampshire. Yep. New Hampshire Fish and Game Laws, Title, whatever those Roman numerals are. The 7 sections prohibit activities such as nighttime seaweed and rockweed collecting from seashores below high water mark.
That leads me to a question. How do you feel about Roman numerals in general? Are you pro or con on those?
I like the way they look. I don't love the things they do to my brain. It hurts my brain a little.
To figure out what number it actually is.
Yeah, I mean, I can figure it out, but like, can you just put 100? Can you just put 100? Then I'll like know really easily. Like people don't use Roman numerals.
We aren't Romans.
We're not Romans.
That's right. I just know because like the Super Bowl every year they do Super Bowl and they do it in Roman numerals.
Yeah, yeah. Which again I think looks very cool.
I can see that for sure.
Yeah. Okay, Andrew. So you've done really well with the past 2 groupings ish. It's okay. But I have the last one for you. Okay.
Okay.
All right. So here are the 3 real or fake laws.
Okay.
And you have to pick the one that is made up. Okay. So the first one is you cannot set off explosives at weddings.
Okay.
Yeah, right.
No explosives at weddings.
No explosives at a wedding, okay? You cannot steal or receive stolen poultry.
You cannot receive or steal stolen poultry. Okay.
Correct. Yes.
Well, that one sounds real to me. So what's the third one?
It sounds reasonable.
I mean, yeah, it's stealing, right?
Mm-hmm,
Stealing should be against the law.
Exactly. And the last one is you cannot import or possess a skunk.
Import or possess a skunk.
Mm-hmm.
Okay. That's unfortunate. I was hoping to import some skunks later today. So I'm hopeful that one is not a real law.
Or if it is, it's not in Ohio.
Right.
Yeah.
Right. At least if it's not in Ohio. That'll ruin my plans for the weekend. I don't know.
You know, what country has
What's the market like for skunks these days? I don't know. I mean, I think the one that's most real is the stolen poultry one. That one has to be real.
Okay.
And then the skunk one could be, what was the first one again?
The explosives at weddings.
Okay. I think that the explosives at weddings, that one is the fake law. Is that right? No?
No. Okay, I'm sorry, but it was a trick question. They're all real.
They're all real?
They're all real. Yes.
So I had no chance
No,
on that.
I'm sorry. I had to really throw you for a loop with that one. But you can get some points back if you guess the state.
Okay.
So which state do you think has a law that you cannot fire guns or set off explosives at weddings?
I don't know. Let's go North Carolina. No.
Nope, sorry. It's Pennsylvania.
Pennsylvania?
Yeah.
Okay.
Yep. So let's see. What do we have here? Under Section 623 of the Penal Code of 1939, a lot of other things follow that. It says it is a crime to serenade a wedding with guns or explosives.
To serenade. Okay, that's the word they chose.
That's the word they chose.
Okay.
Which is such an interesting wording because typically what's serenading people at weddings is like, you know, a band or even a DJ or just a playlist.
Or a 12 gauge.
Or, no, not in Pennsylvania, it's not.
Okay, I guess not. Okay.
Okay, so how about this? What state do you think has a law that says you cannot steal poultry or receive stolen poultry?
I mean, again, I feel like it should be more places than one.
I don't disagree with you.
Arkansas.
No, sorry. Rhode Island.
Rhode Island,
which I guess I don't really see them as like a poultry state,
right?
Because they're so small.
How much poultry can fit in Rhode Island, right?
Right, along with the humans that are there.
There's just not a lot.
There's
of space.
not a lot of space for everybody. Yes. So the actual wording is every person who steals poultry from any building or enclosure in which poultry are kept or confined, or whoever shall receive poultry knowing it had been stolen, shall be punished by imprisonment for not more than 1 year or by fine for not more than $500 or both.
Okay.
So I guess if you didn't know it was stolen and you received it, you should be okay under this wording.
Interesting. Okay. It's only if you knowingly stole or received stolen poultry.
And you knew it was stolen.
And I knew it was stolen.
Yeah. So if we were in Rhode Island, you stole a chicken.
A chicken.
From your neighbor.
Poultry.
A poultry. That's what I almost said. A chicken. And then I knew that you stole it, but you gave it to me. Then
We're both in trouble.
We're both in trouble.
Okay.
In Rhode Island. Which, it's a small enough state, we could probably run out of there pretty fast.
Yeah. Oh, we can make it for sure.
Yeah. Okay. So let's talk about the last one. You cannot import or possess a skunk. What state do you think we're in for that?
Oh boy. Let's go with Missouri.
Sorry. No. Tennessee.
Tennessee. Okay.
Yeah.
Should have known.
Yeah. So this is actually under their wildlife laws. It's under their wildlife laws. And it says it prohibits any person from importing, possessing, or causing the importation of a live skunk into the state of Tennessee.
Causing the importation of. That's...
Yeah, so I guess if you're like in the background sending the emails and like setting it up, you're probably going to get in trouble too.
They're part of the problem.
Right.
I mean,
they are part of the problem.
Yeah.
Yeah. So those are our quirky laws.
I think I got one. Right? Is
Yeah,
that right?
it wasn't a lot. I stopped keeping track because I didn't want to make you feel sad. So.
And I'm happy to introduce our guest today, Dr. Miller Sullivan. He is the medical director of Franklin County Public Health. Thanks for being here, Dr. Sullivan.
You're quite welcome. I'm looking forward to this.
Absolutely. Now, I guess just a little bit of introduction. Like, how did you get to be here at Franklin County Public Health?
Okay, well, I've been doing this for about 24 years now, so it's been a while. But basically, I am a board-certified pediatrician, so I went to medical school. Mm-hmm. But prior to that, I actually have a PhD in anatomy and taught in medical school for a while.
Oh, wow.
I was in practice here for a few years. I dealt a lot with Children's Hospital here in Columbus. And one of my friends, one of the professors there, was Dr. Anne Marie Summers, who was basically a geneticist. And she was on the Board of Health here and for many years. And when the previous medical director retired, they were looking for someone to take on it as a part-time job as opposed to full-time. And that's very common here in Ohio. A lot of times it's practitioners in town who become medical directors. And she talked to me and said, would you be interested? And I thought, well, yeah, this might be something different. I can expand my horizons. I can learn some things. And I've been here ever since.
Yeah. Had you had much experience with public health prior to that?
Actually not. I really wasn't trained in it. I've kind of learned as I've gone along. I've often told people that I've learned more about sewage systems than I thought I ever would in my life. No, and everything else. But no, I did not have formal training prior to this.
No, that's cool, though. I feel like that's any career. You're always just sort of learning on the job, especially in a new endeavor.
You don't want to become stagnant. You want to keep learning new things.
Absolutely, absolutely.
So what does it mean to be a medical director? Like, what does that job entail?
Well, basically, every health department, and I assume everywhere, but it's specifically in Ohio, has to have a physician with a medical license, okay? And the reason for that is we give medicines out, we dispense things. Mm-hmm. We have vaccine clinics where they need standing orders. So basically, and there's other things too. So basically, they need someone who has the authority to designate that be done. So that's real important. But basically, there's a lot of things I do. Different medical directors do different things. In some health departments, they actually see patients and have direct patient care. Oh, okay. Here at Franklin County, we don't have clinics where I would see patients, so that's not something I would do. I've been a full-time practicing pediatrician, so this is a part-time job, but always available. You know, we try to deal with medical issues, we give advice, we try to stay up on the latest recommendations from diseases to immunizations or whatever. And I report to the Board of Health. I actually am directly responsible to them, although I work with, Joe Mazzola, the commissioner, and the nurses mostly.
So, you said you've been here a while, so you've probably seen some things. You've been here through the the pandemic.
Pandemic, yeah.
Give us a little insight. What was it like during that time for you as the medical director?
Well, it was very different. I've always given as much time as the health department needs. So even though technically I work half a day a week, I never count hours and always tend to spend more. So at that point in time, especially at the height of it, we were meeting every day. We were in what's called incident command structure, and I was part of that. We had a Zoom meeting every day. We tried to monitor the latest recommendations from the CDC regarding quarantine and immunization when they were available. I worked a lot with the nurses. We gave advice to the schools, to businesses, how to distance, how to keep people safe. When can you go back to work or school after you've been sick? And just tried to be part of it. But it was crazy.
I can't even imagine. Like, especially being in your role and kind of, having to sift through all the information that was constantly changing and sign off on things and all that.
Yeah.
Oof,
and it was all new. It was something, we've been talking about the possibility of a pandemic for years, but here it was.
Right.
Also, outside of the pandemic, I'm sure you've experienced a lot of other diseases. What else have you dealt with here in your time at the health department?
Well, the one thing that comes to mind is, and this is probably before you were in public health, was back in 2009 and 10 when we had the H1N1 swine flu pandemic, so to speak. And we really felt that was going to be the big one. We were comparing it initially to the 1918 flu pandemic, and we're thinking this is going to be bad. What turned out was it wasn't that bad, it wasn't that infectious, it wasn't that dangerous. But until we knew that, once we had the vaccine, which was very limited at first, we had clinics around the county, maybe 2 or 3 a week. And there were very strict criteria as to who could get the vaccine. So one of the things I and some of the other doctors needed to do was decide, yes, you can have it, no, you can't have it. And that was kind of difficult because people got upset. And then fortunately, the vaccine supply increased and we were able to give it to everybody. And then we found out that, okay, this isn't as bad as it could be, which is good. So that was the biggie. But besides that, there's things we deal with all the time, just depending what comes up. Things like Legionella, which is an infection you tend to see in water systems. We deal with food-associated illnesses sometimes, pertussis, meningitis, West Nile virus, Lyme disease. And once again, it's not direct patient care, but someone has it. It gets reported. Sometimes we have to talk with people about quarantine. Sometimes I even get a call from a doctor saying, well, I don't understand this rule. Why does my patient need to not go to school? Or why do we have to give medicine to the family who's been exposed? And these are rules. These are good public health protocols based on good science. So we deal with some of those. We had an Ebola scare a few years ago, not necessarily here, but it was in Africa, and we were worried about it coming. And right now we have something very similar to that with Marburg virus, which is something that's over there, but we're worried that someone could bring it back here. And that's very contagious and can be very deadly. So a lot of different things.
Your experiences as a practitioner versus your experience as a medical director, how do those two kind of come together?
Sure. So obviously, I've got the medical training, which gives me the basis to do what I do. But I think in going through training, I was a teacher and then a practitioner. I dealt with a lot of people. I learned how to deal with my colleagues, my supervisors, the public, and things like that. And so I think my general training helped me deal with people, and I think that's very important. We all deal with coworkers. We all deal with, in public health, with the general public. And so I think my training basically allows me to do a better job with that. I tend to be easy to get along with. I tend to be able to talk to people, and that's all based on what I've experienced previously. So I think that's the biggest thing I can think of.
That's great.
Yeah.
So speaking of, dealing with the public and people and everything like that, right? What sort of shifts do you feel like you've seen in the public, like attitude shifts, mentality shifts over the years around preventative medical care?
Sure. Well, I can think of a couple things. One, I think we are more aware of disease prevention. It's always in the past been, well, you're sick, we'll treat it, take a pill, and come back if you're sick again. Whereas now we realize that it's much better to prevent disease then treat it because then you don't have the complications. So people are aware of that. They know that smoking and tobacco use is not good. They know that they need to have a better diet and get exercise, avoid alcohol and things like that. So I think that's one of the biggest shifts that we've noticed. The problem is it's not easy to do those things. So people still smoke. They can't get off of it. People still, eat the wrong diet and don't get exercise. But they're at least, I think, aware of it. I think the other shift is, we noticed through COVID, there is antagonism at times. If you don't believe in something, you get very upset about it, as opposed to let's accept that maybe there are differences of opinion. And whereas before, I think people accepted things more that we said, and now they tend to challenge it a little bit. And that can be kind of frustrating.
Yeah, no, that makes sense.
Absolutely, yeah. And as we're going into flu season, what are some big things that people should be aware of?
Well, this is one of my favorite subjects because we deal with it. We deal with it every year, and it's pretty much the same with some variations. So, flu season, or I like to call it respiratory season, is basically mid fall through early spring in this area of the world, and we deal with various diseases, a lot of viral respiratory illnesses, including things we can treat like flu, RSV, COVID, pneumococcal disease, whooping cough, which is pertussis. And every year we have these show up, and we have some really good preventions against some of them. We have vaccines, and the vaccines are very effective at preventing severe disease, and in many cases, preventing disease together. So one of the things as public health people, we really need to encourage the use of these things. Yeah. Once again, there's a anti-vaccination factor out there, and people are very hesitant, especially after COVID, unfortunately. So basically, there are other things everybody can do if you don't want the vaccines. If you're sick, you can stay home. You can use good hygiene. So if you're coughing, you can not cough on people. You can cover it with a tissue or cough into your arm, they always talk about. If you're sick, get tested. Find out what you have if we can identify it, and then get treated appropriately. It's a time of year where we know something's going to show up, and we want to minimize it as best we can. And then whatever comes along, we try to deal with. If the vaccine doesn't completely match the strains that are out there, we have to deal with that. If for some reason there's more whooping cough than there had been, we have to deal with that. So there's general things, and then each year is a little bit different.
And it's interesting, I always sort of associate in my mind like the physiological flu, cold respiratory season with like the mental health side of seasonal depression, right? Those things go hand in hand because they come around at the same time. So I'm sure you probably saw people with things like that. Obviously, you're not a psychologist, right? You're a pediatrician, but what do you often recommend to your patients who may come in with like seasonal depression or struggle in that time of season?
Well, first of all, we encourage them to try to stay healthy. So do some of the things we've already talked about.
Yeah.
We want people to have a good diet, get exercise, get enough sleep. Try not to get stressed. It's hard in life, but have some type of stress relief. Go out with your friends, have a hobby, play a sport, whatever you like to do. And so things you can do to kind of decrease that often will help depression. And the other thing I tell people is if you're feeling depressed, if you're feeling down, whether it's due to the season or other reasons, and it's not getting better, go talk to somebody. Yeah. Sometimes a therapist helps, sometimes medication helps, and there's nothing wrong with that. This is a very complicated world we live in, and these things are available to help us deal with that.
That's awesome. Thanks for saying that.
Some great advice for sure. Now, to get a little bit more personal, what sorts of things do you do to stay healthy? If it's like foods, is it physical activity? What sorts of things do you do?
Sure. Well, a lot of the things that I mentioned above, I do. I try to eat healthy. I like potato chips. I like my desserts.
Yeah.
I don't practice quite as much as I preach, but I try to. I do stay active, and I recently retired from practice last spring, but I continue to work here at the health department, and I love it, and that keeps me busy. It keeps my mind going, so that's very important. I do things with friends. I do things with my church, and I like to do sports. I'm a little limited because I have some knee issues, so I can't do the basketball quite as much as I used to be able to do, but I ride a bike, I garden, I walk the dogs, go out with the kids. I have some grandkids, and we do stuff with them. Aww. So I try to stay active both physically and mentally and do healthy things.
That's awesome. What did you grow in your garden this year? As it from one gardener to another?
Oh, I've gotten more into flowers than vegetables
fun.
because my garden, when we moved into our house 30 years ago, had a lot of sun, and now there's some big trees and it's shady. And if you're a gardener, you know a lot of vegetables don't grow so well. But I have some pots with things. So tomatoes, peppers, the standard stuff. I grew some potatoes in bags this year, and it really worked
fun.
out. I just dug them up, emptied them out.
Yeah.
And I have tons of flowers. We do annuals, we have perennials. And I like that. I also work in part of the gardens in my church, so
cool.
that keeps me busy. It hopefully can share some of what I do.
Yeah, that's amazing.
And one thing we do like to ask all of our guests, if you could wave a magic wand and change anything you wanted, related to the public health world, what would you change?
So before I got into this, I really didn't know what public health did. I mean, I knew you were out there, we were out there, but I didn't know. And I think that's still the case. I think people just don't know what public health is all about. I think we're undervalued. It's a word I use, maybe even underappreciated. Yet all of us go to the restaurant or the food truck or the fair and assume that the food is going to be safe. That's public health. We all assume that, when we have wastewater at home, it's going to be treated appropriately. That's public health. Yeah. We all feel that if there's a disease out there, someone's going to deal with it, and that's public health. Yep. So I think what I would like to do is raise the awareness of what we do so people can appreciate us. Everybody wants to be appreciated.
Yeah.
And the other thing I would add to that is, it'd be nice that the government would appreciate us more and fund us a little more. Not that we don't get funding, but I think sometimes they don't realize how important it is.
Of course.
And until something arises, you can be taken for granted. But maybe that's good. Maybe that means we're being successful.
Right. Yeah. We're kind of in the background, but, it's a good space to be because if we're in the forefront, then something's probably going wrong.
That's good. I like that. Yeah. So that's kind of what I'm thinking about.
Yeah. That's very cool. Yeah. We've had some very interesting answers to that question.
Yeah, we always have to specify that it's a public health related thing you would change, not just some...
the world,
Yeah,
world
like
peace.
you want to have some money, all that.
Yeah.
Dr. Miller Sullivan, he is the medical director of Franklin County Public Health. Thank you so much, Dr. Sullivan, for coming on the podcast today.
Well, I appreciate you asking me, and when I heard about this, I was hoping you would invite me. And you did. And I'll be glad to come back sometime and talk about something else.
Amazing. We'd
Great.
be happy to have you.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.